At least 106 million Americans have been fully vaccinated, and it was just announced that the FDA is expected to authorize the Pfizer vaccine for kids ages 12 to 15 any day now. With that said, re-entering everyday life is expected to be safer. So how should parents view their children heading to summer camp? We'd like to welcome back Dr. Allison Eckard, professor at MUSC. Thank you so much for joining us again, doctor.
Thank you. My pleasure.
So perhaps you can dispel some misconceptions, because we've heard that kids are really not the carriers of COVID that we first thought them to be. But now we're hearing that they make up a larger surge in the virus. So what does this all mean?
There is a misconception that children can't get COVID or they can't pass it. And that's really just not true. In the age of kids who go to school, there really is an ability for them to get it and pass it, particularly when they're close together, like in the school setting or when they're playing sports or for summer camp.
Why do you think right now we're seeing a spike?
So some of the spike that we're seeing right now is reflective of spring break and people getting a little tired of the pandemic, taking off their masks, being more complacent, more spring sports. All of those things combined are causing this increased number of COVID cases in children.
I see. So now we're seeing more people being vaccinated, adults I'm talking about. Millions of vaccinations have been administered. And so we are seeing maybe the nascence of what could be considered herd immunity. But what about when now we want to send our kids back to school? Where do we need to be? Where's the safe zone that we need to be in order to feel comfortable with that?
Right. So right now, we're not just seeing an increase in the percentage of children getting COVID because adults are getting vaccinated. We're actually seeing an increased number of children getting vaccinated. And I do think some of that is because adults are feeling more comfortable going out themselves, but forgetting that the children haven't been vaccinated. So the more people that we can get vaccinated and the more careful we can continue to be now until the end of school, we'll be in a much better place in a couple months, and hopefully for the fall, we'll see a completely different outlook.
And before that even happens, kids want to go to camp. Parents want to send their kids to camp. So what do you think is recommended? Away camps, overnight camps, or ones that the child is coming back and forth every day?
So just like being in school, camps serve a very important purpose for children. They develop socially, developmentally, emotionally. So we want our kids to go to camp. We just have to be careful in how we do it. So every camp has a different level of risk depending on what the camp is, a sports camp versus an overnight camp. So that risk level may be different for an individual child or their family, but understanding that risk on an individual level is really how we can help families make that decision for their own children.
And how do you go about selecting the safest camps? You know, there's different camps. There's a camp for everything now. So whether it's academic, physical, fun, what are the safest ones, and what do you hear camps are doing to ensure that either social distancing is taking place, sanitation is a key and a priority? What are you hearing?
So every camp should have a written policy on how they're dealing with COVID. We are not in a place just to open up schools or camps and have a free-for-all. We need a written policy as to how they're going to protect children. And so how much they do may depend a little bit on the type of camp. So overnight camps, for example, are going to be the highest risk. And so parents should look for the tightest policies for overnight camp, for example. But those that are outdoors, those that have physical distancing, those would be a little safer options than something indoors and overnight.
And of course, kids are going to be intermixing with adults who are either the chaperones or overseeing the camp themselves. So would it be wise, and are these camps basically stating that anybody who is a part of administration, they need to be vaccinated?
So every camp has their own policy, but I am hopeful that many of these policies will include encouraging everybody who's eligible to be vaccinated. So that really will be the safest option. We have a little bit of time left before the end of the year. And as you mentioned, we'll be opening up hopefully in a week or so for that 12 and up group for the Pfizer vaccine. So the more staff, teachers, children, families that we can get vaccinated between now and then, the safer our camps are going to be.
Okay, and just real quick, what has been the reaction? Because some adults, when they get the shot, the second one is kind of the doozy. Are children also experiencing the same things, or I should say younger adults experiencing the same things? And what can we expect for that age group, 12 to 15?
So the younger age group do tend to have a little bit more side effects because they've got a stronger immune system, to be honest. So we expect them to react a little bit stronger, which is a good thing. So they may have some mild side effects like a sore arm, feeling tired, but they tend to be very mild. In the vast majority of people, they tend to be a little bit worse with the second vaccine. But we feel that the vaccine is very safe, and we encourage everybody who's eligible to get it.
Okay, and is there one age group that really is not at risk for COVID?
No, in fact, we have seen children who are hospitalized from very young age all the way through adolescence and young adulthood. And multisystem inflammatory syndrome happens. We are seeing record numbers, and that is a post-infectious inflammatory syndrome that happens in healthy children. So we really want everybody who's eligible to get vaccinated.
We'll leave it on that note. Dr. Eckard, I want to thank you so much.
My pleasure. Thank you.
We're back in 2 minutes.